Namaste. Today I just want to talk a few things about Guillain-Barré syndrome, that is GB syndrome, which is making a lot of news in India, particularly in the city of Pune, where people speak that there is a big outbreak. More than 150 or 170 patients have been recognized and been treated, few of them in the ICU, a couple of deaths. So what is GB syndrome, and what would happen if the patient acquires GB syndrome? What is the outcome? And is it new? Is it something like COVID? So these are the doubts which so many people have asked me. So GB syndrome is a old disorder. It's bacterial infection based. Campylobacter jejuni is one of the primary causing organism, which is usually associated with poultry, that is chicken related, and also in other animal products. Say partially cooked meat and chicken or something like that would probably trigger an infective condition. And does everybody who get infected have life-threatening complication? No, not at all. A simple viral disorder or a simple bacterial disorder like presentation would be there. Nausea, vomiting, fever, dull aching, discomfort. These are the common features what a patient can present with. But unfortunately, some patients get into a very serious scenario where they develop a situation called ascending neuromuscular weakness. That is, from the lower limb upwards, they develop weakness in the muscles. Slow. You need to start with the weakness starts with the lower limb, then it comes into the trunk, the upper limb, and the respiratory system. If it is very critical, patient may develop respiratory distress, and maybe even they may fail to respire because the respiratory muscles doesn't act. They may get into a situation where they have to be monitored in the ICU on ventilator. But sometimes it becomes such difficult, the patient may succumb to the condition. So what I would suggest or advise is, see, all the animal products we need to cook well and then consume. That is one primary thing. And also maintain good hygiene, which probably will help you in the long run. And that is the basic understanding of normal lifestyle. So don't panic about GB syndrome, and it will definitely not be a big pandemic most of the times. It is a localized condition, and probably the respective government authorities will take action on the primary origin of the disorder. Action in the sense they may try and trace out where probably the outbreak is and then fix the issue. I think we get a message right, and we should be able to manage ourselves well. Thank you.